During the exit interview, the vision screener shares the test results with the patient, provides educational materials, and may give a referral to an eye care professional. A referral should only come from a certified school. During the exit interview, you want to evaluate the results and check for legibility. So did the patient fill out the form completely? Did they sign the statement on screening? Can you read what they wrote? Also, during the exit interview, you're going to provide recommendations for when they should see an eye care professional. Those recommendations can include seeing a doctor soon, seeing a doctor now, seeing a doctor regularly. And I'll talk about that on the next slide. It's important that you don't suggest a diagnosis during the exit interview. As well, during the exit interview, you want to provide an eye care report to all patients who are going to get referred to an eye care professional. For the free clinic, we do not do this because we submit applications online. But generally speaking, typically, if you were vision screening at a different site, you'd give them an eye care report. Again, the free clinic doesn't do that because we submit applications online directly to PBO, and then the results from the eye exam are then submitted online as well, either by us contacting the patient and inquiring about the results of the eye exam, or the eye doctor submitting directly to PBO the results of the eye exam. Typically during the exit interview is when you want to provide educational brochures. However, the clinic does not have any patient education materials regarding different eye diseases at this time. Another important aspect of the exit interview is to ask the patient if they have any questions. In regards to the risk assessment questions, Prevent Blindness Ohio has certain recommendations for each individual question. So for example, if a patient says yes to having persistent pain in or around the eye, Prevent Blindness Ohio recommends that they see an eye doctor now or immediately. Basically, go to the emergency room because something very serious is happening. Missed stimuli during the visual field test, we don't have one of those machines, so that does not pertain to us because we don't have that type of equipment. If a patient says yes to the question that their vision has changed in the last 12 months, then Prevent Blindness Ohio recommends they see a doctor soon. Soon means that they should see a doctor in the near future. If a patient has diabetes and has not had a dilated eye exam within the last year, then the recommendation is to see an eye doctor soon. And if a patient gets 20/50 or worse in either eye for near or distant acuity, then the recommendation is to see an eye doctor soon. And again, soon means to see your eye doctor in the near future for professional eye examination. These descriptions are also in your booklet. Other recommendations that aren't featured on this slide include see a doctor annually. What that means is that Prevent Blindness Ohio recommends that the patient see a doctor once each year for a professional eye exam. The next recommendation is see a doctor regularly. If there's a recommendation for see a doctor regularly, that means that the eye doctor will suggest periodic visits based on a professional eye exam. So they should see an eye doctor, and based on seeing the eye doctor, the doctor will then determine how often they should come back for an eye exam. Again, this is in your vision screening booklet, starting on page 35. Sometimes multiple risk factors suggest the need for a comprehensive eye examination, even if the test results do not indicate a referral. So in this type of situation, you're going to have to make a judgment call. And oftentimes I tell screeners, to follow your instinct. Generally speaking, though, referring patients who answered yes to 2 of the risk assessment questions is grounds for referral to an eye care professional for an eye examination. When referring a patient for an eye examination, it's important to explain the reason for the referral and to emphasize the most urgent recommendation to see an eye doctor. It's also important to point out once more that this is a screening and not an examination. and only an eye doctor can diagnose and treat eye problems. You want to give special consideration for patients who refer to see an eye doctor now. Typically, if a patient is having persistent pain in or around the eye, then they probably want to go to the emergency room because something serious is happening. For example, the retina might be detaching, and if they're not given treatment quickly, then they could go blind. It's important to give special consideration for patients referred to see an eye doctor now. It's important to note that persistent pain is described in the risk assessment as steady, not intermittent. A patient indicating yes for persistent pain needs to be referred to an emergency room, as I stated previously. The screener must exercise judgment as to whether the pain is significant in nature and attempt to determine whether it may be related to other causes such as a simple headache, allergies, sinus, cold, flu, or eye strain as opposed to an eye disease. In regards to visual field testing, we do not do this, so I'm not going to talk about this. There's information in your booklet about this. So this slide is unique because we don't use the Prevent Blindness Ohio forms. Traditionally, the Prevent Blindness Ohio forms consist of 3 pages, white, yellow, and pink. And when the patient fills out the white page, it bleeds through, so all pages have all the information. And so it would include, what you record as the screener. So typically with the Prevent Blindness Ohio form, you give the patient the pink copy. Now the free clinic doesn't use this form, so we'll have to photocopy our form and give a copy to the patient. But for the sake of the test, you give the patient the pink copy of the adult vision screening form. So this is another unique slide. We do not give out the eye care professional report. If you want to read about it, it's in the booklet, but we do not give this out. We do follow up with the patient after they had the eye exam and to get the results, or if we give out a VSP gift card, the VSP eye care professionals, they actually submit the results directly to Prevent Blindness Ohio. But again, we don't give out these forms, so you don't have to worry about this. Once the assessment is complete, so the patient filled out the registration form, they answered the risk assessment questions, you facilitated the distance and near visual acuity testing, and now you're at the exit interview and you assess the results and determine does the patient need to be referred or not referred, etc. At this stage, it's really important, again, to look at the form. Did the patient fill out all the information? Can you read it? Did the patient sign the statement of screening? Were the screening results entered in the appropriate areas? And was the eye exam referral box checked if a referral was made for follow-up care? This slide is another unique one. We do not currently have any patient education materials about the different eye diseases, so we do not give this stuff out. So maybe in the future we'll start collecting these, but at this present moment we don't have any patient education materials. It is important to note that you should provide the patient with a copy of the vision screening registration form. In regards to follow-up, I would recommend reading the booklet, and when you're taking the test, go off of what the booklet says for follow-up. As a vision screener at the free clinic, you will not have to worry about follow-up because that falls under the director of rehab. So again, make sure you refer to the booklet regarding patient follow-up, and that should help you with answering questions on the test. If you have any questions when you're taking your test, please feel free to contact me directly. You can text me at 614-448-8124. You can email me at bridgettek@gmail.com. You can talk to Rochelle. You can look in your booklet. It's open note. You can consult with people. You can also feel free, if you have any questions, contact me in Prevent Blindness Ohio directly. Here's the contact information on the slide.